We're having fun. We are now live on Facebook, LinkedIn, YouTube, Instagram. Are we ready? We're good? Hi, Instagram. How are you? Dr. Rob Silverman. Every week, we're going to be Tuesday, 2 p.m. Eastern Standard Time. So let's start it out. Let me know where you're from. New Jersey, New York, California, overseas, wherever you're from, let me know. Some really good news. We've got a couple of new organizations that are going to get involved with our Q&A. We're going to have Factor Education run by Todd and Jessica Riddle, Dr. Todd and Jessica Riddle. I'm excited. They have placed some questions. We're going to work in the collaboration forum. So Instagram, get ready. Facebook or Facebooks, get ready. TikTok, give me a double tap. Give me a double tap and let's go. So here we are. Question number one that was sent in on Facebook. What's the key to longevity? Well, first off, as you heard me say, longevity is your ability to live a longer period of time in a healthier state and be more vital. So some of my longevity hacks, I put them right here. I wanted to make sure I didn't miss any longevity hacks. Number one, nutrition. Let food be your medicine. Let medicine be your food. Hippocrates said that without question. It all starts with what you put in your mouth. Let's make good choices. Number one thing to remove is no ultra-processed food. It's unbelievable that the government agency, the FDA, says there's no data to imply that ultra-processed foods are bad for you. It's absurd. That's crazy. You know, there are moments in your life and there are moments in your employment history that are fireable. If you said that, you deserve to be fired. Amongst bring you back to my old friends that still live in the Bronx, and that's a whole nother story. No way. That's absurd. Also, dramatically reduce your sugar or added sugar. Again, ultra-processed food, and of course, any kind of starch. Exercise, incorporate resistance training. Muscle mass is the currency of longevity. So it's not about being as big as Arnold or being like a bodybuilder, but it's, you know, really holding on to good quality muscle mass. So you're going to do that through resistance training. You can do it through body weight. I just had a 45-year-old gentleman who needed to put a little muscle on. We suggested some bands, even the TB12 bands, Tom Brady bands. Great choice. TRX, you know, there's some great people out there doing kettlebells, dumbbells, barbells, etc. But some form of weight resistance. Your body is weight resistance. Sleep. What a hack. What an ingenious hack. Everybody should be getting good quality sleep. 7 to 9 hours of sleep allows you to be rejuvenated. Health detectables. I'm wearing one right now. I'm wearing my Oura Ring. Does a great job. Oura Ring will let you know a bevy of different things. In addition to that, I'd recommend, if you could, a glucose monitor. There'll be a question later talking about glucose monitors. Lifestyle and mindset. Health is wealth. Let's just remember that. Let that be everybody's mantra. Health is wealth. Intermittent fasting, we talked about that a little bit. I'm a big proponent, especially for men, 14-hour fast, 10-hour feeding. I hear so many people say, hey, what do you think about a day or a 3-day fast? I really don't think about them. Unless you have cancer, I'm not big on those type of fasts, certain religious aspects aside. I like people to eat, but I like them to eat in a small window. I'd like them to eat good quality foods, whole foods, foods where you don't have to look at the ingredient list. Breath work. My good friend, Dr. Sachin Patel, does a great job with breath work. Everybody should follow him. Big shout out to him. He's made breath work at the cusp of everybody's consciousness. Purpose, mission, and community. This is our community. This is our purpose. This is what we do together. So my purpose is to help people like I was helped. That's why I went into chiropractic. I have my thing going on with my congenital torticollis. I was lost. I'm just so happy I found the chiropractor. It was actually, you know, literally like a half a minute walk for me. You know, we're able to treat each other and to remember to lay down with my head face down at 21 years old, extremely skeptical and scared. And now at 58 and a half years old, being confident and having 25 years of experience helping people, it's been a great trek so far. Hormesis, hot and cold exposure. So hot and cold exposure to the idea of Sauna's 140 to 180 degrees. Don't go over 200 degrees. You don't want to go over 200 degrees because it can damage the blood-brain barrier. Your cold baths, your showers, 50 to 59 degrees. Good quality supplements, as we talked about, low-level laser. Leon, how are you? I am doing great. I'm happy that you popped in. So next question. What's my morning routine like? Well, my morning routine is real simple. Let me give you a few facts. Get up in the morning, say 6 o'clock in the morning, and everybody have some filtered water, add some lemon, have some water with apple cider vinegar. Great choice. 7 a.m., start with your elixir of life, organic coffee. So have organic coffee with either allulose or stevia in it, a good MCT oil, and I add collagen. I have my breakfast at 8 o'clock, so I can finish eating by 6 o'clock that day, that 10-hour window. I try and do a little mindset meditation. I set myself up for the day. I start with some positives, and I always try and do one thing before 8 o'clock, one thing for 8 o'clock that I feel that I didn't know the day before, whether it's a word, how to conjugate it, whether it's a word in Spanish, something like that. So I feel like I'm better than I was the day before. Do we have any questions online? Okay. How can I improve my posture? What a great question. We live in a world where everything's in front of us. I just put my hand up. You know, that's typically what we do with the iPad, with the cell phone, with the laptop, because I have a laptop right here. You guys can't see it. There's a camera. So we live in an interior world. We live in an interior head posture world. Brugger technique. We will download I'm looking at the staff. We will download a exercise that's called Brugger, so everybody can reset their posture. Instagram, Facebook, hit me twice, tap, TikTok. So how do you treat chronic inflammation? Ooh, whoa. I'm taking a half a sigh because I do believe that chronic inflammation or people being pre-inflamed are one of the biggest issues that we see in America today. Chronic inflammation start with food. Food, as you've heard me say, can be a potentiator for health inflammation. Bad food can be a potentiator for inflammation. So you need to choose wisely which foods. Fried foods, vegetable oils, sugars pose a major problem to overall chronic inflammation. Supplements for chronic inflammation, I'll give you my big three: pro-resolving mediators, omega-3 fatty acids, and turmeric. How do you approach meal planning? Well, my meal plan, I'm very fortunate. My wife is the best cook. She could beat Bobby Flay any day of the week. Yes, you can. She's going like this to me. She's a fabulous cook. So meal planning is easy because it tastes so good. But the premise is you should meal plan. You should cook for the next day, next 2 days, next 3 days. There's some people that cook for the week. I prefer to do it on a Sunday and a Wednesday and try and meal plan. Weigh your food out, measure it out, time your food out. It doesn't mean that you can't eat out. Just choose wisely when you eat out. What's the healthiest way to detox? I think that's a whole live to itself. How to detox. Your liver is your oil filter to your body. It takes away all the toxins. So we have to remember that there's fat-soluble toxins in your body. Fat-soluble toxins are stored initially in your fat cells because fat cells are depositories for toxins. That said, when these toxins come out, they have to go to the liver. For me, the best way to liver detox is use a good qualified program, powder, and food diary that allows you to stay on your mark. Some of the things that I would avoid that are on the commercial market that absolutely drive me crazy are when I hear I'm going to juice my way to a detox. That doesn't work. There's a couple of reasons why. Number one, it's all fruit juice. Fructose, and that amount of fructose is very detrimental, deleterious to one's overall health. Number two, it's all sugar carbs. And sugar raises your inability, or should I say, raises your imbalance in your liver to break down toxins. So sugars are a major, major problem. And number three, there's no protein. We need protein in those shakes to allow for the enzymatic reactions in the liver. The whole point is to bifunctionally modulate a liver that's imbalanced. So your liver is split into halves. There's phase 1 and there's phase 2. Phase 1 is typically too quick from certain things like drugs, even coffee, alcohol, and sugar. So this inability to bifunctionally modulate the liver poses an issue. So when you take sugar, you go like this. You really push the seesaw up in the air. And I know some of us used to want to do that, but you don't want to do that with the liver because it won't break down this fat-soluble toxin, which has to go through the liver process to make it through a water-soluble toxin. So a good qualified detox program should take anywhere from 15 to 30 days the first time. I'm a big believer in patients coming in for the first time, doing a qualified 30-day detox, then do a 10 to 15-day detox in the fall and the spring. Some things you do not have to worry about in a detox. Some of the more commonly asked questions. Will I live in the bathroom? The answer is no, you will not live in a bathroom. It is not a colonoscopy. It is not preparing for a colonoscopy. It is not a poop session. You will be okay. 70% of the toxins that are dispensed through your body are dispensed through your exhaled breath. So you're not going to live in the bathroom. Let's move on. Best exercises for overall wellness. I think any exercise you can take where you are is great for overall wellness. So exercises that I like, walking is great. Light running, running on an appropriate terrain. Body weight exercises like push-ups, air squats, planks. If you so desire, and if you're able to, one-legged squat. You want to really raise it up. You want to challenge yourself. Well, burpees. Woo! Here's an exercise for you. Here's what I do when I'm on the road in a hotel. So it's 10 minutes of burpees. Now, if you think I'm doing 10 minutes of burpees straight, you're crazy. So my goal is to do 10 burpees in 20 seconds and have a 40-second rest. And then do 10 burpees again. So I can get to 100 burpees in 10 minutes. Now, a big thing in CrossFit is 100 burpees in 7 minutes, but I'm age disadvantaged. So if I can do that, I've got my heart rate up. I've incorporated a lot of things. Some other great exercises, obviously swimming, an outstanding exercise. Pickleball has become very fashionable too. Again, grabbing one kettlebell, you can do so many different exercises, from clean snatches, one-arm rows, squats, core activation. So exercises, anything with your body weight or one easy device to carry with you. Band exercises. I have a question from my Laser Mastermind group. My Laser Mastermind group knows that I do a lot of programming. I do a lot of frequency additions to people's protocols. So the frequency is the amount of light, or the amount of times the light hits your skin per second. Of course, the key ingredient to laser is the wavelength. The wavelengths of choice are 405, 520, and 635. So the question was, how did I work out in my protocol list the timing specific to the frequencies that I use? And it's real simple. The truth of the matter is it was a trial and error. So I got as big a group as I could of patients, and I tried and errored and hold on with that. And I also used as many docs, because I'm very fortunate that I get to go on the road and lecture to doctors. So I got as many docs as I could, put it all together, and came up with some time. Now, so for instance, I may say 493360 is the frequency. 493360 is the frequency, and it may be 3 minutes. Now, you may, if you could, let me have you help envision 3 specific people. Here's LeBron James. Here's me, Rob Silverman, and here's my dad, who just turned 93 years old. LeBron gets lasered, I get lasered, my dad gets lasered. LeBron may not need as much time for his proverbial sprained ankle. It's my sprained ankle as my dad's sprained ankle. So it's a starting point. It's a recipe. It's not necessarily hard and fast rules. Just checking if anybody else is inquiring. Nope. So here's the questions that come from Factor Education. I'm excited to get into some of these. These are really good questions. The question was, I have a patient I believe may have an eating disorder, or at least an unhealthy relationship with food. Tread carefully if they have an eating disorder. They often ask me for advice on ways they can change their diet to see a big change quickly. There are no big change quickly. It just doesn't work that way. There are slow changes that lead to a dramatic drop in weight and a dramatic increase in health. If you're losing 10, 15 pounds in a week, it's probably too much to everybody's chagrin. So that's my advice. Let them understand that. Let them understand it's a process, but it's a weekly, monthly, bi-yearly, yearly process, depending how far down they are on the health scale. So they're nervous to even talk about food with them and run the risk of saying the wrong things. You're not going to say the wrong things. Have a list. Get a list of foods. Get a list of health foods, foods that are salubrious, fruits, vegetables, grass-fed beefs, wild fish. Use the acronym SMASH, salmon, mackerel, anchovies, sardines, and herring. Things like that. Give them lists. Look at the list. I just looked at the questions. It's okay. I have a laptop here. It's okay. And have the conversation. And just, don't necessarily make it, don't make it like they're doing something wrong, like they got a bad grade. Just tell them, here's the way to get to a healthier you. So they want me to settle the milk debate. Okay. Which is the best for overall health? Cow's milk. Hold on. Let's stop right there. That would mean that we're drinking another mammal's milk. Wrong answer, Jeopardy says. No shot. Do not consume cow's milk. No dairy. But okay, let's go. Almond milk, oat milk, soy milk. Well, these are nut milks. They call them plant milks. Now, they can be adverse to your health as cow's milk because they use so many emulsifiers. They use so many additives. So you're looking for, let's say, oat milk or almond milk. You're looking for the nut and water, and that's it. And they're out there. There are a few companies that are out there. If you have that, add it to your Elixir Vitae and enjoy your day. Is there better than another for an athlete versus a child or an older person? What do I think about milk for weight loss? I think if you take out dairy, you'll find inflammation will go down dramatically. I think if you take out dairy, you'll find out that you can lose weight because of the inflammation, and it's just a lot of extra calories. It's not really nutrient rich. Do you have any supplements you recommend for dealing with anxiety and depression? It was interesting. I just filmed a podcast with James White from KBMO. He's the CEO of food sensitivity testing. And in an IRB study, we found out that if you remove your food sensitivities, the number one set of symptoms that will decrease will be anxiety, depression, and anything under the proverbial mental health category. That said, the number two set of circumstances was brain fog and gas and bloating. So, number one, remove foods that are irritating your gut, remove foods that are irritating you. Number two, supplements that I found that work really well, things that stimulate the vagus nerve tone. So a probiotic like Lactobacillus acidophilus, B. longum, L-reuteri. Did you know that L-reuteri also has a positive effect for those people who suffer from ASD? So a good pre and probiotic, great choice. Take the foods out. Continuous glucose monitors. More and more non-diabetic people are wearing them. Do you recommend these to your patients? And if so, what type of patient is most beneficial for? Can't wait to hear your answers. Thank you. Continuous glucose monitor is a great choice because, one, it will give you such an edification on how you individually respond to foods. Great example. Let me ask everybody a question. Rice versus coconut flakes. Which one would raise your blood sugar? 100% of you say rice. Rice is a carbohydrate. Coconut is mostly a fat. Correct. Coconut is actually a fatty fruit. Well, guess what? This individual found out that his blood sugar goes up more from coconut flakes than rice. Go figure. There's no known reason why. So one, you'll see if there's any aberrancy. It's one of my aberrancy. And two, you really see how many carbs you eat, and you really see how you mix your food, and it'll give you a great gauge as you go. If we were to walk around with our phone like this, not necessarily like this, not knowing, I bet you we'd all behave better, at least food behave better. So you have that continuous glucose monitor, you will be in tune with what you're eating. Everybody who's done it has been somewhat surprised by some of the results because everybody's an individual. That's what makes healthcare so exciting. Everybody's an individual. Doesn't matter. Every day I have to throw the book out and add a new page to the book. So that's really interesting. So my suggestion is to do that. Let all your friends and family know that at 2 o'clock, are you coming? Do you have any? Nope. At 2 o'clock, Tuesdays, Eastern Standard Time, we're here. We've already grown up to over 20 minutes. We have a few more companies that are looking to go. Hey, look at that. Guys, I think what happened was some people were late, but hi from Connecticut. Hi, Angela. Happy to see you. We have grown from 8 minutes on the first time all the way up to we're going to be over 20 minutes. I think next week we'll be here for 30 minutes. I think we're going to have that many questions. So I really want to thank everybody for sending your question in advance. Please do so. If you're seeing this Memorex, put it in the comment section. I will answer any health question you have, supplement, exercise. Don't forget TikTok, tap, tap, Facebook, press like, Instagram, just keep following me. We love it. And let's also thank Factor Education, Dr. Todd Riddle and Jessica Riddle. Secret Functional Medicine University will be jumping on real soon, and we have some other people interested. So let's all join the cadre. I'm Dr. Rob Silverman, always yours at home.
55 years.
500 and change.